In addition to the difficulties in fully classifying structural defects, we also encounter significant limitations in the evaluation of functional muscle contributions to the pelvic floor disorders. Our current classification system relies on a simple and limited evaluation of pelvic floor muscles, with an inability to characterize potential passive and active muscle contributions to a patient's condition.
The effective management of stress urinary incontinence requires understanding of the anatomy and function of the female pelvic floor. Tactile imaging, translating the sense of touch into a computer image, allows biomechanical assessment of pelvic floor conditions, including muscle function. Objective: to introduce new clinical evaluation tools with a vaginal tactile imaging probe, which allows high-definition pressure mapping to assess pelvic floor function by quantitative and anatomically sensitive manner during voluntary and involuntary muscle contractions. We designed a new vaginal tactile imaging probe to image the entire vagina, the underlying support structures, and the pelvic floor muscle contractions in real time. The probe sensor has 96 sensor arrays along either side, and it measures approximately 11 centimeters in length. A motion tracking sensor, a temperature controller, and 2 microchips that communicate with the main computer. We implemented the software support for high-definition pressure mapping during voluntary, prompted flicker and sustained contractions, and involuntary, cough, pelvic floor muscle contractions. The patients were studied with a vaginal tactile imaging probe in a lithotomy position. We enrolled the first 26 subjects of 150 planned into an observational case-controlled study. They were asked to complete an assessment of comfort and pain levels for the tactile imaging procedures. Results: all 26 patients were successfully examined, and data were recorded using the vaginal tactile imager. The preliminary data analysis reveals the following findings. We observed significant amplitude difference in voluntary muscle contractions for anterior versus posterior and left versus right side, which may allow recognizing of muscle avulsion and further characterization of their functional conditions. The pressure patterns during involuntary muscle contraction, cough, are substantially different from the voluntary contractions as in amplitudes as well as in peak locations. Patients with normal pelvic floor conditions demonstrate higher pressure applied amplitudes in both voluntary and involuntary muscle contractions than patients with stress incontinence. The pressure patterns during involuntary muscle contraction, cough, with stress incontinence conditions have distinctive structures from the patterns without stress incontinence. It seems possible to characterize functional conditions of multiple dynamic pelvic structures. A typical examination with vaginal tactile imaging probe takes 2 to 3 minutes. 54% of patients classified VTE comfort level as more comfortable than manual palpation, 30% as the same, and 16% as less comfortable than manual palpation. Only 4% reported pain with the examination. Our findings demonstrate that high-definition pressure mapping during voluntary and involuntary muscle contractions may be used for the assessment of pelvic muscle conditions and defects that contribute to stress incontinence. This research is being supported by the National Institutes of Health, National Institute of Aging. Thank you for watching our presentation.